My name is Amy Matten. I'm a doctor of acupuncture and Chinese medicine, and I work at Reproductive Medicine Associates of Connecticut, coordinating their integrated fertility and wellness program. I'm here today to talk to you about the convergence of the old and the new, combining both acupuncture and Western medicine for fertility.
Hello, I'm Elaine Mallon, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist. I've been part of the acupuncture team here at Reproductive Medicine Associates of Connecticut for 7 years, and I've been practicing for 12.
There has been a lot of hype about adding acupuncture to Western fertility treatment, and I definitely think we deserve a place at the table. Western science is really catching up with acupuncture in terms of how it works, so we have a lot of really solid research and evidence how acupuncture is being used to promote fertility in terms of balancing hormone levels, reducing stress, enhancing circulation to the reproductive organs.
With the goal of your fertility, not only will it help you be healthy and improve your fertility, it's going to help you be more healthy during your pregnancy. It's going to help you be more healthy after you have the baby. And that's what you want. You want to be at your best for everything you do.
I also think that we can treat in a space that Western medicine can't. So Western medicine is wonderful at breaking things down into their component parts, looking at hormone levels, looking at follicular development, looking at the thickness of a uterine lining, looking at semen analysis and breaking that down. And acupuncture is really pulling back and it's looking at the whole patient. So it's looking at what's your energy level like, how's your sleep, what's your emotional world like, how's your digestive system, and it's treating the whole patient, body, mind, and spirit. And really when you combine those two modalities is when you get the best possible outcomes and patient experience.
Combining the two really brings the best of both worlds.
So why combine traditional Chinese medicine and Western medicine for infertility treatment? Why does it make a difference? These are two complex medical systems that really complement each other very well, and loads of reproductive endocrinologists support acupuncture and Chinese medicine for their patients. We're really combining the best of both worlds. You have Western medicine, which is able to take a complex problem like infertility and break it down into its component parts, and has amazing diagnostics and imaging studies and therapeutic interventions for the fertility patient. And then you've got traditional Chinese medicine, which is really pulling back and looking at the overall landscape of the body. What is it about the environment of that patient's body that allowed infertility or another problem to develop in the first place? And we want to treat that. We want to treat that underlying pattern of imbalance or disharmony and see if we can help restore the functioning of the body.
And it's really important that it's a system just like Western biomedicine. We observe, we measure, we analyze, we customize, we prescribe, and we treat. And it's all within a framework.
When you combine those two things, it's really a tour de force. And what we're seeing is that we're having better outcomes when we treat the whole person, body, mind, and spirit, from both a Western medical standpoint and adding in traditional Chinese medicine to complement that. And we're getting wonderful results for our patients, and we're hearing from the patients themselves that it's a very different experience.
I find acupuncture to be kind of fun. It's a time to relax. It's a time just for me. I leave relaxed. I leave breathing slower. And more confident in where we are headed with our cycle, what we're doing, and knowing that I'm doing everything possible to help it be successful. I often go twice a week when we're in cycle, although it doesn't always work out. But for the most part, I go once during the week and then once on the weekend, which does mean that I see two different acupuncturists, but they work together and they share my file so they know what's been going on. There's absolutely a continuity of care there. And they also then are able to address whatever the doctors are seeing from monitoring visits that I may have had in between visits with the acupuncturist.
I was fearful in the beginning. I probably wasn't educated enough, but I found that it was extremely helpful in numerous different ways. First of all, it didn't hurt. My idea of needles hurting was quickly corrected. It was not painful at all. It actually was soothing. So I remember I did all my treatments with Amy Matten, And I remember in the beginning saying I was surprised at how quickly my body felt relaxed once the needles were in. Usually before the needles were even finished being put in the appropriate places, my body completely relaxed, and I could feel this sense of peace and calmness, and I was just in shock. I couldn't believe that something essentially so little could have such a big impact, and that at that point I also realized just how stressed my body was if I was noticing the difference so quickly, and so significantly even.
I want to spend a minute talking about stress, acupuncture, and the infertility patient. There's a lot of debate about whether stress causes infertility, but I don't think there's any debate that infertility causes stress. So for any of us who have struggled to conceive or have been in infertility treatment, you know that it can be very difficult and it can be a really emotionally challenging time. And I think this is an area where acupuncture really shines.
We'll be focusing on not only the root of the stress, calming your nervous system, getting all those fight or flight hormones to stop cascading out of your body into your body and help you produce the feel-good hormones you produce naturally. So we'll be going to the root, but we'll also be going to what we call the branch. So that's the signs and symptoms you would have. When you're stressed, does your digestive system go bananas? Do you have trouble sleeping? Do you grind your teeth to dust? Are you getting headaches? We'll be focusing on working on those signs and symptoms as well.
It's important because one of the reasons people drop out of treatment, even people who have insurance coverage, is stress and anxiety. It just becomes too tough to manage, and sometimes people drop out. And the truth is that if we can help patients hang in there, they often can get the outcome that they're looking for, right? A pregnancy and a healthy baby. So combining acupuncture with high-tech Western medicine can really help people manage the rigors and the stresses of treatment, and help them stay in treatment till they get what they are looking for.
We did end up having success on our fourth transfer, and at that point, we decided that it was, we knew it was safe to continue acupuncture. The fear that I had, even though I had fallen pregnant and had success, was far more than I anticipated having. That fear didn't go away just because I got a positive test and, things seemed to be working. And so I really at that point felt like I needed the acupuncture maybe even more so than I needed it prior.
For the providers, why they should recommend acupuncture, I think number one, the stress level. One of the number one reasons people drop out of treatment is because of stress. So having a modality that helps them deal with the stress and feel better will help keep them in their treatments and get them the result they ultimately want.
So I would advise anybody to consider adding acupuncture into their treatment protocol. Make sure that you look for a licensed acupuncturist. Make sure that that person has experience working with infertility patients, has worked with a reproductive endocrinologist before. And I think that you'll be really pleasantly surprised at how helpful acupuncture is, not just to help you conceive, but to help you manage the journey along the way.
I think the hardest part of acupuncture is when you have an itchy nose and you can't scratch it. You got to stay still. So learning to breathe through that and take some deep breaths, and then suddenly your thoughts drift away, and then 5 minutes later you realize that your nose doesn't itch anymore. But that's probably a skill that I am learning and have learned, and that breathing through things is something that I've found to be helpful during this process.
What do the needles do? They are minimally invasive whisker-thin needles, and they stimulate the nerve-rich areas of the skin surface. And this influences tissues, glands, organs, various functions in the body. Each needle is just a tiny little interaction with the body that causes little sensation, and it's enough. It's enough to signal the body so it knows to act. And what does the response involve? It's the stimulation of the immune system, promotes blood circulation to an area. It helps with wound healing. It helps with pain modulation. It also makes changes to the brain and your hormones, as we talked about before. And it alters the pain pathway through the body.
So, a little bit about the research. Years ago, back in 2002, there was a landmark study published. It was called the Paulo Study, and it looked at combining acupuncture on the day of embryo transfer. It was just 2 treatments, one right before the transfer and one right after, and the results were really impressive. And it got people really excited about looking at combining these 2 forms of medicine. And for a while there, the research sort of got stuck in that space, looking at pre and post embryo transfer acupuncture. And the results were pretty variable. But over time, there's been a movement to research the medicine in the way it's clinically practiced. So there's a lot of people who felt that pre and post embryo transfer acupuncture is just a drop in the bucket, and that giving people a standardized protocol just on one day wasn't really reflective of clinical practice. And what happened if we look at the medicine the way people are really using it? So infertility is a complex problem, and it often requires prolonged treatment. And there was an interesting study published recently by Lee Hollander-Rubin, who's a wonderful researcher and practitioner. And what she did is she looked at just that. She did a retrospective study looking at people who had had prolonged treatment, individualized diagnosis, and customized treatment versus people who just had usual care, versus people who just had pre and post embryo transfer acupuncture. And not surprisingly, she found that the people who had whole systems Chinese medicine over a period of time had better outcomes, and that was reflected in higher live birth rates, which is really exciting, and I think helps to show people what's possible when you're utilizing this traditional Chinese medicine in the system and the way it was intended for patients.
Acupuncture is helpful for fertility because it increases blood flow to the reproductive organs. That brings more oxygen, more nutrition, helps create ATP, which is the cellular food for the cells so that they have enough energy to grow and implant. And it smooths the nervous system. So it does this in a couple ways. If you take a functional MRI of the brain, we know that it dims the parts of the brain that are lit up when there's pain and stress, and helps illuminate the parts of the brain that are active during rest, relaxation, and peace. We're also able to know that acupuncture helps promote you producing all the feel-good chemicals you produce naturally. Your serotonin, epinephrine, there's a whole list. So why not make yourself feel good?
Not only did my body relax, but I always used the time while I sat with the needles in to just really reflect on where we were in our journey and to try and release my fears and my anxieties. They always had spa music playing, the lights were dimmed, there were warm blankets on or the heater in the room. An extremely comfortable setting for sure. That was another kind of fear I had in the beginning was, is this going to be uncomfortable sitting with needles in, laying on a bed? What if I have an itch on my face or if I have to move? None of those ever were an issue. Never did I encounter pain or any sort of discomfort from that.
I think the best way to help a patient feel at ease with an acupuncture treatment is really to just explain what you're doing. So when you're taking somebody's pulse, explain what you're feeling for, and explain why you've chosen the acupuncture points and how it relates to their Western medical treatment and their Chinese diagnosis. I think it's really about having an open dialogue with people so they're engaged and feel part of the treatment, and understand why you've selected the treatment modalities that you have.
Providers should also be aware that fertility is not the only thing most patients are going through. They have the other conditions that they normally have, chronic migraines, digestive issues, other underlying conditions, and those are things that can be addressed with the acupuncture. Again, the whole goal is to optimize the patient and make them feel and be as full of health as they can be, all of which will ultimately help their fertility.
People will come in and they'll say, I'm not sure about this, but my doctor suggested it, or I have a friend that's done fertility treatment and found this really useful for them. And you don't have to be a believer, right? So acupuncture is effective, and it has profound effects on the body, whether you buy into it or not. And it's sort of enjoyable to have somebody come in and maybe be a little bit doubtful, and then experience for themselves the benefits of acupuncture.
Acupuncture is not something that I'd done prior to fertility treatments. Quite honestly, I hadn't thought about doing it, and I'm not real sure I I certainly didn't think I had a need to do it. Now I realize how helpful it is for all kinds of things. But it is not something I'd done prior to coming to RMA. Somebody encouraged me to give it a try, and I really enjoy it and have now done it for all of my cycles.
So in summary, why does acupuncture deserve the hype? It deserves the hype because it's a powerful, centuries-old form of medicine that has stood the test of time. It can help regulate hormones, improve blood flow to the ovaries and the uterus, optimize reproductive function, and manage the stress and anxiety of treatment.
The patient should consider seeking out acupuncture and Chinese medicine because it will optimize your health and well-being, your physical health, your emotional health, your spiritual health, and your mental health. And who doesn't want that?